Dr. Van Mol, what are you seeing on the front lines of policy when you're out there testifying in state legislatures or international fora, as I said, saying standards, laws, and regulations? What would you say is the toughest ground, and by that I mean the most difficult battles? You're a family doctor engaged in this arena. What do you think is most bitterly contested on the medical front?
There's two answers to that. The first problem is me being a board-certified family physician. I know that if I were to go in a court of law, the other side's attorneys would gleefully spend hours trying to get my testimony disallowed because I'm a family physician, I'm not an expert. And they would likely succeed with the average judge, which is why I apply myself to other avenues where I can be more effective. So in more direct answer to your question, and by the way, if I were a family physician working for the gender clinic, now I'm an expert. But you know the literature better than they do, and the attorneys don't want that in court, so they just get your testimony disallowed, and it's not hard for them to do. More direct answer, you were asking about, okay, what are the roadblocks? The problem is the ideological capture of the medical organizations, legislators, media as a whole, and not just the academic world, but also, and I'm sorry, I'm having a hard time getting it out of my mouth here. I'm just going to have to let it go. I apologize. So these pillars of society have been taken in by the trans ideology, masquerading as science, which it is not. And it's reinforced with emotional blackmail. You have to support this or they're going to kill themselves, which is also not true. But it doesn't matter. And you ask them, how do you back this up? It's like, it's what the experts say. It's what the organizations say. That's not proof. In fact, that's how groupthink and herd mentality work. So all roads lead back to WPATH, the World Professional Association for Transgender Health, which is an American deal. It's not a medical organization. It's not a legal one. It's an advocacy group. They're activists. They don't even have a comprehensive literature review backing up their stuff. There has been the first of its kind evaluation in the peer review literature, an article that basically evaluated these guidelines wherever they're found in the world for what we'll call strength of evidence. And the WPATH standards of care, number 7, SOC 7, rated 0 out of 6. And yet this is the one that's being pushed to cause all the other ones. And just because they call themselves standards of care doesn't make it one. But now they're up to SOC 8, which has removed all age restrictions, be it from puberty blockers to cross-sex hormones to surgery. They've removed age restrictions. This cannot be science, So my answer to it all is there is always a more honest answer to gender confusion in a minor than chemical sterilization and surgical mutilation of what is otherwise a very healthy young body.
And am I correct, Dr. Van Mol? This is just a yes or no question. In the latest versions of the standards of care, eunuch is a gender identity?
That's there too.
Yeah, eunuch gender, whatever that means. Let's talk about junk science versus actual science. When solid, sane researchers and people examine the literature treating gender confusion with hormones and surgery, and they actually take a look at the evidence, what happens? Certain nations like Sweden have done so in recent years, Finland as well, the UK, the Tavistock Clinic, the famous clinic, has been ordered to close. The state of Florida here in the United States has done this. But what happens when scientists actually review the evidence? And I've got a follow-up for you after you answered this one.
Yeah, the studies that support, gender-affirming therapy, which I prefer you think of as transition-affirming interventions, because that's what's going on, uniformly show that those studies are of low to very low quality. What does that mean? By definition, that means they fail to show what they claim they are showing. I know of 6 comprehensive literature reviews, 3 out of the UK, 1 out of Sweden, 1 out of Finland, and 1 out of the state of Florida. And that's what they show when they look at it. And in the UK, it's the National Institute of Healthcare Excellence, which goes by the acronym NICE. So the NICE review on puberty blockers, the NICE review on cross-sex hormones, and the CAS review interim report. It's not even completed yet. And with the release of that, and other things that have been going on in the culture and in the courts and whatnot, like with Bell versus Tavistock and all, the UK closed the world's largest pediatric gender clinic, just closed it. And what we see now in the UK, Sweden, Finland, and just 2 weeks ago, Norway, is 4 nations that were leading the world in, gender-affirming, transition medical interventions, have done a complete turnaround, a complete 180. Again, they were leading in it, and now they're like, no, this is not supported by good data. For minors, if you're 18 and under, the answer is comprehensive psychological evaluation and therapy, both for the patient as well as the family. Why? This is easy. Why? There's decades of literature showing the overwhelming probability in a gender dysphoric minor of underlying mental health problems, of adverse childhood experiences, of kind of bad family dynamics, and a way overrepresentation of autism spectrum disorder, and that these all predate the gender dysphoria. So, again, there's always a more honest answer to gender dysphoria, gender confusion in a minor than chemical sterilization and surgical mutilation. What they need is to address those underlying issues, and it comes with mental health evaluation and treatment. And there's absolutely no way that happens in a 40-minute visit to Planned Parenthood that gives you hormones.
Or 30.
Yeah, or less.
Follow-up question to that, though. In the podcast series, you mentioned, talking about junk science versus actual science. There was an article in the American Journal of Psychiatry a few years ago by Richard Brandstrom and John Pachankis, published. The media breathlessly reported it in celebratory fashion. But then a few researchers looked into it, and a correction had to be issued. Tell us what happened with that study.
Yeah. And you'll notice that whenever there's a new study singing the praises of transition, magically, immediately, it's covered in media from coast to coast with pretty much the same talking points, and that can't be coincidental. Well, such is what happened with this Brandstrom and Pachanka study, the first of its kind, comprehensive review of 9.7 million Swedish medical records, looking at it over a year. And when the study was released, it said, well, gender-affirming hormones, as they say, didn't achieve any improvement in mental health benchmarks, but gender-affirming surgery did. Well, I got an early copy of it electronically from Alliance Defending Freedom, asking me if I'd have some, me and some of my teammates do a white paper on it for ADF, because they needed it for a Supreme Court case they were in case it came up. So I did that, but we followed that up by getting a letter to the editor written. So I called together a team, myself, Paul McHugh, the emeritus chair of psychiatry at Johns Hopkins University, titanic figure in American mental health, Dr. Miriam Grossman, a child and adolescent psychiatrist, and Dr. Michael Laidlaw, an endocrinologist. And our letter to the editor just showed the flaws in this study and why it didn't show what it said it did. It got published 10 months later, but with 6 others, so 7 negative letters to the editors, all getting published at the same time, with a bracketed paragraph from the journal editors saying, we were concerned enough with what the letter said, we hired an outside team of basically statistical analysts, which that doesn't happen often, and I wish it happened every time. And they largely agreed with the critics, so we asked Brandstrom and Pachankis to do what they should have done in the first place, reanalyze their data looking at some stuff they didn't report on. And they concluded that neither the gender-affirming hormones nor the gender-affirming surgery generated improvement in the mental health benchmarks they were looking at. But it's worse than that. In the letter to the editor from them, that was along with all these other things getting published on the same date. They generated one table that showed mental health before surgery and after. And I'm sure you're thinking, well, shouldn't that have been in the original study where they said it helped? Oh yeah, but this kind of stuff rarely is. And it showed every single endpoint they looked at was worse for those who had had surgery than for those who didn't have it. Now, of course, our taking down of the various people involved, it wasn't just me, sorry for saying that. For this study being taken down, was that reported in the media from coast to coast? Oh, bum study, flawed conclusions.
I was just going to ask, how widely was that reported?
Yeah, not too widely.
Not too widely.